Dr. Roger De Sesa.
Thank you, Elsa. So today I have a diagram. I'm hoping I can get to this, and if I can't, well, we've got nobody else speaking after me, so I don't know, maybe we'll do something with it. But there was a couple questions that came up off of this thing. I finally realized what this is all about now, so I think I can maybe, I can answer some stuff here. Somebody asked me if I do home visits. I used 2 years ago, but it's got to be one of those things that's, I will go once in a while to do a home visit. It's been kind of a while, but if you really need me to come to home, if you're that incapacitated, I may just be able to do that. People have my cell phone number, but it's expensive, I'll be honest, to have me visit you. But call me, you can get a quote if you like. I'm a bookworm. When did I start reading? Because my family's not a bunch of readers. The first in my family to go to college. So that was a big accomplishment for me and for my family. So on that note, I wasn't really didn't really grow up as a reader. The pivotal book for me was something called Clear and Present Danger by Tom Clancy. I read that book, and for some reason it just got me excited about reading, and then I started the process started, and from there I just kept going. Somebody was asking about spinal conditions, some real crazy ones like spinal cysts. Anybody heard of a ganglion cyst before? You know what that is? Ganglion cyst pops up above a joint, and it's kind of a painful thing. But what it is, it's synovial fluid from the joints underneath it. Well, every place you have a joint in your body, there's a potential for synovial fluid to leak out, and it creates a little pocket or a cyst. And in the spine, that's just called the spinal cyst. I don't really treat that, by the way, and I'll go over some of the things I don't treat, and I'll talk about what I do treat, just so we have that on the table. Do I know about arachnoiditis? Go to Google on that one. I mean, but basically it's inflammation of the nerves, and it's created by a few different conditions, but I don't treat that. My thoughts on epidurals? I can tell you that's a great question. I would ask a poll, but you know what? Let me just throw this out at you. I very consistently know that moms who come into my practice who have had children who have had epidurals seem to have some degree of back pain that just does not ever go away, even if it's just a little bit of slight back pain. Something about piercing through that covering or this epidural sac, it creates scar tissue, which creates binding and results in things not moving the way they're supposed to, and can be a source of pain. So although I do get results with women who have had epidurals before, there seems like there's a bit of pain that just never really seems to go away. So not that would be a bummer, okay? I'm not trying to bring anybody down or anything, but if you had one, you can talk to me about it. What activities cause back? Does anybody know what the number one thing we do that causes back pain? Number one thing that we do in our jobs on a day-by-day basis. Sitting. Yeah, thank you. Yeah, so you all know this is not news, right? That's why they call sitting the new smoking. Not only does it create problems with increasing risk of stroke, increasing heart disease, lowering the immune system function, increasing cognitive function. I mean, there's a whole bunch of stuff that goes with too much sitting. But also, when you sit for prolonged periods of time, the joints of the spine start to take an impact too, because we have these built-in shock absorbers, the ankles, the knees, the hips, and when you're sitting, those go away. And now all the force of gravity in your upper body just compresses down those joints, and the muscles start to stiffen up too. So I tell you, of all the things that we do, prolonged sitting is one of the worst. So just stop doing it. There's great tools out there now, like Veridesks, which you can adjust them. You can make this go up or down, changing the position. So if you have the option of being able to get a Veridesk where you work, if you're sitting for prolonged periods, use it. Get one. And if not, like fit balls work pretty good too. They kind of roll around, but they're a little unstable. So and also repetitive motion. Repetitive motion is the other thing. So if somebody does a lot of twisting or turning one direction to get one thing over and over again, they're going to cause problems. That's why I like golfers so much, because they swing and over again. Why do I do this profession? This profession chose me. There's no other way to explain. There's no doctors in my family. There's no chiropractors. There's nobody in health. There never was. One day, a word just hit me in the head. It was just God's divine, what they call that, divine intervention. And I was on an airplane on my way to Helsinki on a trip that I'd won, and it was the craziest thing. I couldn't get the word out of my head. Chiropractor, like, what the heck is that? So I got home and I started looking it up, and I'm like, well, this seems kind of cool. I quit my job at the liquor store. Actually, I had two jobs. I was working for a liquor store and a bank. I was going to be a banker. But anyway, so I pursued this, and I guess the rest is just history. So sometimes we have to listen to those wee little voices, because sometimes they really tell us a lot. But the big thing there is just shutting up. Just enough to listen to them and hear them first, right? Okay, what makes a difference from others in my field? Okay, so I think really when patients come into my practice, I sit down and listen to them. And so many times I hear people go, I went to this doctor, I don't think he heard a word I said. And he spent 2 minutes with me, in and out. And I never wanted to be like that. Everybody who comes to see me, there's a relationship that starts first of all, and they come to me as a friend. Like, I don't look at it like, there's this whole thing like, the relationship of a doctor and patient is cold, it's steel. The doctors have to have this persona. They don't want to be emotionally involved with their patients, and they want an outcome. I've never, maybe if you're going to a surgeon, I can see that, but I'm a person who has a relationship with people, and I really want to see people at their maximum potential. I see people coming in, I don't see people that are broken or hurt or in pain. I see somebody who has the ability to reach so much more in their lives. It's physically, mentally, emotionally, and maybe I can be something, a conduit to make that happen. So I think that's what makes me just a little bit different. I have patients come in and go, I've never had a doctor listen to me before. Thank you so much. I'm like, oh, that's what everyone should do, right? Everybody in our field. So, okay. And then after that, what is your self-care practice? Start the morning with gratitude, meditation, exercise, breathing exercises. Wim Hof, I'm a big fan of him. Fish oil, fasting, and then by the afternoon I am eating a lot, and then I go through a ritual at bedtime too, which is being grateful, projecting my next day. Every time before my head hits the pillow, I think about what am I going to get done tomorrow. And then when I wake up in the morning, I do the same thing, meditation for 20 minutes, and I have these little index cards. I think the best purchase I ever made was 4x6 index cards. And a really pretty pen. I like pens that write well. And I'll do 20 minutes of meditation, and I'll just write out everything I want to get accomplished that day. And sometimes it's just like pray for another 20 minutes or whatever it might be, or call somebody or a friend or send a thank you note. And then at the end of the day, if I don't get to it, it's cool. I can open it up and go, okay, that's something I can do tomorrow, or I'll put that to Saturday. So that way I'm scattered. I'm all over the place. Like, yeah, this is no joke, right? I mean, this is supposed to be one circle, I'm kidding. Anyway, so my thing is just trying to keep focused, and there's so much going on. And you know what it's like. We're professionals, we have families, and we have so much going on, and sometimes we really have to just like get concise about what we want. And there's always a big goal. Like there's my 5-year goal, 10-year goal, and I'm always consciously working towards that too. Okay, cool. How much time do I have? Anybody? 3 minutes. 3 minutes. Dang, that is a 5-minute exercise right there. Okay, let me do what I can with this for right now. People want to know what I do. Okay, there is something called a subluxation. Okay, that is a misalignment of the vertebrae in the spine. Now, you can call it whatever you want because there's different professions. Medical doctors call it a spinal lesion. It's called an abnormal movement segment mover. I don't care, but this is what we call it in my profession. Now, the subluxation creates something called nociception. Nociception is a form of pain. It's a negative thing in our bodies. It's a signal that it has that's not creating a positive change. So this is nociception. Now the first thing that happens with the subluxation is it synapses with the spinal cord. And if you didn't know, the spinal cord contains 50% of all the neurons in the body. It's a pretty important structure. Okay, now that's important. Now the other thing that happens with the subluxation is we get this thing called a muscle spasm. And along with muscle spasm, we get something called vasoconstriction. Really fancy way of saying the blood vessels start to tighten down a little bit. And when the blood vessels tighten down, it creates a pattern of muscle spasm, and that creates a pattern of vasoconstriction. So it's a wind-up cycle. Now we got a pretty serious problem going on. Now the spinal cord, well, that's a pretty important thing. Now it synapses with a part of the brain called the thalamus. Now, hopefully I don't lose you guys in this. Thalamus is like a sensory relay center in the body. The thalamus's job is to figure out what's important and what isn't. Because if you didn't know, the thalamus then goes to the cerebellum, and that's our highest level of conscious, right? But if you didn't know this, check this out. The cerebellum takes in 3 trillion bits of information per second. Does that, Micah? I know you're busy over there, but can I? 3 billion per second. Trillion, 3 terabytes of information per second. Now I ask you, is the fastest computer in the world coming close to that yet? 3 terabytes a second. I'll answer that. You kind of like, we're getting close, but we're not there. We're not there yet, but we're getting close. Now imagine that. Here is the greatest supercomputer ever known. Don't you feel pretty powerful right now? All right? But here's the thing. If you had to think about 3 trillion bits of information per second, you'd be a blob on the floor, right? Could you imagine trying to filter all that out? So the thalamus goes, hey, I'm only going to put through what's important. And that comes out to about 50 bits per second. 50 bits per second. Because, if you had to think about your butt on the chair, your back against the back, and your hair on your head touching your shoulder, oh my gosh, you'd be nuts, right? You'd be crazy. So the thalamus also has an important job of synapsing with other parts of the body as well. So then there's the hypothalamus. Now the hypothalamus is a neuroendocrine regulatory center. So it's a real fancy way of saying the nervous system's got to figure out how to run the glands and all the other stuff too. Now the hypothalamus is a pretty important job because it also synapses with, the pituitary gland. Okay, now the pituitary gland, if you didn't know, this one has to do with growth hormones and also parts of stress. Pituitary then also communicates with something called the adrenals. Anybody heard of the adrenals before? Yeah. Okay, so adrenals release something called adrenaline and noradrenaline and catecholamines. And these are responsible for increasing your heart rate, fight or flight, sort of stressful situations. Now what we have here is stress, right? Doesn't that look like stress? So not only that, but now the thalamus also synapses with a part of the brain called the amygdala. I'm running out here, right? I'm going to have to kill this, and I hate to do it because we're getting some good stuff here. The amygdala is an anxiety and stress relay center in the body. Okay, I'm sitting down now. I'm done. All right.
Hey, you're on, Dawn. Keep going.
Okay. Now, that stress regulatory center also goes to another stress relay center called the locus coeruleus. Locus coeruleus, now that one goes to another one called the oh my gosh, hypothalamus. Oh boy. Yeah, now I'm stressed out, right? Because I totally the hippocampus. Thank you very much. Okay, so that's my adrenaline's pumping right now. I'm in this. I'm living this right now, folks. So if you don't know what it looks like, this is it. Okay. So this is called the hippocampus. This is really interesting because what happens is we have enough stress in our bodies. We have the hippocampus is responsible for learning. It's our learning center. So you ever try to learn somebody's phone number after you've been in an accident? Or let's say somebody like a tiger's chasing you. Can you relate to that? I mean, to me, this sounds like ADHD. My cat. All right, your cat. Your cat's chasing you. Okay. Now the other thing too is that the thalamus also the solitarius nerve, which has to do with visceral sensation, and then another one. There's another relationship here with the hippocampus that goes to the vagus nerve. Now, the vagus nerve runs a lot of the important stuff in our body, like breathing and digestion and other stuff too. So what happens is when we're under stress, our breathing goes down, digestion slows down, lots of other things will happen, and then after this, we have another cycle where it goes from here to back to here again. Now we have more stress. Okay, so it's a wind-up cycle of stress. So this problem right here has a cascade effect. Last thing that happens is, boom, that's the sympathetic nervous system. Sympathetic ganglion system. So my writing's gone at this point, so my stress is so anyway. This is the stuff that controls blood vessels, it controls digestion, it controls other things in the body. So that immune system, all right, so that's a pretty important one. So this cycle right here, in my opinion, is not good. Now you throw in life's other stresses on top of having something misaligned in your spine, and the crazy thing is you don't always feel it. And that's where I think that just the travesty of all this is. If a bone went out of place in your back and you felt it right away, I would have it made. Like people would go, oh, that's it, I need to go to my chiropractor right now. Oh, I gotta go to my chiropractor right now, but we don't always feel it. Sometimes people get in accidents and they go, oh, I'm okay, I'm sore for a few days, it's totally normal. But what happens is that accident shifts something out of place enough where over time it's gonna start to create wear and tear problems and issues. I don't know about you, but I don't want one of these, and I do everything I can to make sure I don't. So I get my chiropractic adjustment at least once a week. And I think everybody, if you can't see the benefit of doing this and why people say, well, you got a spine, you should see a chiropractor. Well, I mean, I feel the same way, because if you do, especially if you've had any kind of traumas or anything happen, then you should get things checked out at least once to find out what's going on if we can help. So, okay, that, boy, phew.
You did great.
Thank you. Wow, that was, seriously, that's like 10 minutes right there. Anyway, so I'm gonna wrap that part up. No questions, can I just sit down now? Okay, cool.
Oh, you can take yours.
I can take this, all right.
All right, thanks, Dr. Roger.
Thank you.